Time for your healthy dose of information from Hannibal Regional Hospital. And today we're talking about breastfeeding, and joining us is the lactation consultant and clinical educator from Hannibal Regional Hospital, right?
Yes.
It's Diane Bibb. Diane, thanks for joining us here in Studio H.
Good morning. My pleasure to be here.
Good morning. It's great to talk to you about this topic. I have to admit it, I know I'm a guy. We all realize that, but I love this topic of breastfeeding. I think it's a great thing. People should be encouraged to do it, and as a society, we should get behind it and support it because it's great for the mom and the kids, right?
You're absolutely right, and that's one of the things we want to do is bring awareness to breastfeeding and help promote it for more moms and babies to receive the health benefits from it and for moms to be comfortable breastfeeding.
And a lot of times I think that kind of gets overlooked with work schedules, with families who have input, with women who may not be wanting to try to do that or something. But if the effort's put forth to do that with mom and baby, it's a great thing.
Yeah, it is. And there's a lot of information and help provided out there for moms who are going back to work, going back to school, to help them be successful with meeting breastfeeding goals for themselves and their babies.
That's great. And the support you offer them starts with the Chris Coons Women's Care Center at Hannibal Regional Hospital.
Yes, it does. We're the only baby-friendly designated hospital in the state of Missouri currently, one of only 194 that are designated in the United States, but it's becoming quite popular. There's 700 to 800 hospitals now working towards baby-friendly designation.
How do you get the baby-friendly designation? How did you do that?
Well, it does require, it's a fairly lengthy process, and it does require the hospital practicing in a manner that's very evidence-based. What the research shows sets up the best atmosphere for moms and babies giving birth in our hospital to be successful with breastfeeding. We had to submit, baby-friendly is actually a World Health Organization, UNICEF, supported group, and they send site visitors out to the hospital to make sure we're doing all of the things we say we're doing.
And the first week of August coming up is World Breastfeeding Week. Can you tell us a little bit more about that?
That's also a worldwide event, and it's to bring recognition and sort of publicity towards breastfeeding. In Missouri, they designate the whole month of August. The governor designates it as Breastfeeding Month, just to bring awareness to breastfeeding and help promote it.
And the theme for World Breastfeeding Week this year is breastfeeding, a winning goal for life. And it's a great thing. And some of the benefits that Hannibal Regional Hospital patients will receive from the recognition of that week, and also the baby-friendly designation, are what?
Well, our parents are cared for in a way that does help them be successful with breastfeeding. We provide all the care in the room, so parents learn how to soothe their fussy baby, set them up for success when they get home, learn their baby's feeding cues, set them up for success with breastfeeding when they get home. We also provide a lot of support systems for our breastfeeding moms and babies, both in the hospital and after they're discharged.
And the moms and the babies are together 24 hours a day.
Yeah, they room in 24 hours a day. We provide all the care for the baby at mom's bedside, so she can, again, learn that care and see what's going on, so she's more informed when she gets home from the hospital.
And while she's there at the hospital, too, you probably, as a lactation consultant, you probably meet with the patient, with the mom at that time, right?
Right. I'm not the only lactation consultant on staff, and we do try to see all the moms and babies while they're in the hospital. Our nurses have also received a tremendous amount of education just in breastfeeding so that they can provide all the bedside support moms and babies need.
That's awesome. Are moms more encouraged about breastfeeding these days, even for themselves? Are they more interested than they were a decade or two ago?
Yeah, we're seeing a huge increase in moms breastfeeding in the hospital. In our hospital, over 80% of moms come in breastfeeding in the hospital, and throughout the United States, about 77% of moms start out breastfeeding right after their baby's born. So those are quite a big increase from 30 years ago. In the 1970s, only about 22% of moms started breastfeeding. So,
wow, that is a huge increase.
Mm-hmm.
And you're really excited about keeping that going, right? Just
Yeah.
keeping that on the rise.
Well, we know there's tremendous benefits to both mom and baby throughout their life when they breastfeed, and the benefits are dose responsive. So the longer mom and baby breastfeed, the more benefits they're going to get. So we want to set those moms and babies up to be successful, not only in the first few days right after the baby's born, but as they continue throughout at least that first year of life of the baby.
What are some of the benefits to mom and baby?
Babies benefit not only with short-term benefits of reduced ear infections, reduced respiratory infections, but they also benefit lifelong. There's reductions in some childhood cancers, leukemia specifically, SIDS, and childhood obesity. And with the current obesity epidemic in the United States, that's a nice benefit as they grow older.
It starts off the mom and the baby bonding immediately, and that can last a lifetime too.
Yeah, that's another nice benefit.
It's a really great thing.
For moms benefit with a reduction in breast cancer, a reduction in ovarian cancer. Moms see a benefit with reduction in diabetes, cardiovascular disease, metabolic syndrome as they age too. So big benefits for moms.
And how's society responding to that? You mentioned, for moms, it's easier for them to now accept breastfeeding, and they're doing it more so. Is society allowing them that opportunity to breastfeed these days and being more supportive of it?
It is getting better. There are now state laws that are in effect to help protect moms and breastfeeding so that anywhere really a mom and baby can be legally, they're allowed to breastfeed. And I think that is helping. I think we still have a little ways to go. I think for most people in our society, bottle feeding is still the cultural norm. When they think about babies, they think about bottles. They don't think as much about breastfeeding. But I do think that's improving.
Good. And I think even last year in the state of Missouri, there were a couple of cases of moms breastfeeding where that were like in legislature, and they were ruling in the favor of the moms, saying this is fine, they can do this.
Yeah, that is true. And actually last year, the Missouri State Legislature strengthened the law on breastfeeding to allow jury exemption for breastfeeding moms, just recognizing that it's hard for those moms if they get called up for jury duty right after their baby's born, being separated from the baby if they're not used to pumping and there aren't provisions available for them.
Well, when you talk about breast pumping, something that you'll need to do if you're back to work and you still got the baby at home and you want to keep that going, talk to your employer when you go back to work. Talk to them about the opportunities that you have there to be able to express or to be able to maintain that, so you don't just have to abandon it just because you're returning to work, right?
Right, you're absolutely right. And the part of the Affordable Care Act did have legislature in there allowing most moms to get very good breast pumps through their insurance companies. If they just ask their insurance companies, they do provide excellent breast pumps in most instances. And there's also federal laws now for businesses that employ greater than 50 people, saying that if you have a mom coming back to work and she's breastfeeding, you need to allow her time to pump and also a place to pump.
That's awesome. And you give moms all this information, too, so they know that. How long does Hannibal Regional Hospital support new moms after they leave the hospital?
We continue supporting them as long as they're breastfeeding. We offer a breastfeeding warm line. The warm line's number is 573-406-2122, and in that warm line they can call 24/7 with any breastfeeding question. We also offer a support group, a breastfeeding support group for new moms and babies, and it's been recently renamed the Honeysuckle Cafe. That group meets every Monday at 5 p.m. and Wednesday mornings at 10 a.m. And moms don't have to sign up. It's free. It's an ongoing support group where we bring in the hospital scales if they want to check the baby's weight. We have nutritious snacks for moms and babies. And it's kind of a fun group. Moms get a lot of mom-to-mom support. We provide a lactation consultant if they need any more technical support as far as breastfeeding goes.
That's great. A lot of good information. And what if moms are sick? What if they are breastfeeding, but then they need to take medicine or something? You can work with them through that process, too.
Yes, we can. There's a lot of misinformation out there as far as medications. And yes, if they have any concerns about that, they can contact us. There's excellent resources. While there are a few medications that are not safe for moms and babies when they're breastfeeding, most medications are okay. Moms also sometimes run into trouble if they need to have surgery or if they need to have specific tests like MRI scans, CT scans done, and those are safe for moms in most instances to continue breastfeeding.
All right. How long do you recommend that moms breastfeed? To what age?
The current recommendations from the American Academy of Pediatrics are to breastfeed exclusively. That means nothing else in the baby's diet for the first 6 months, and then start introducing solid foods at 6 months, continue breastfeeding until the baby's at least a year old. There are huge immunological benefits to the baby if they continue breastfeeding, if mom wants to, on into the toddler years.
Okay, very good. And for more information, you can call the Chris Coons Women's Care Center at 573-248-5161. You can go to hrhonline.org/breastfeeding and get more information there too. All right, Diane Bibb, lactation consultant and clinical educator for Hannibal Regional Hospital. Thanks a lot for your great information. And,
Thank you.
Thanks for encouraging moms and babies for a healthier future. It's good stuff. Thank you very much. Thanks for your time this morning.
Thank you. It was good to be here.
It's 8:24 right now on News Talk Live. That's your healthy dose of information from Hannibal Regional Hospital.